everyone, and thank you for joining the NeedyMed Special Topic webinar, Connecting Underinsured Patients with the Treatment They Need, presented by NeedyMed's partner, the PAN Foundation. I'm Carla, the Director of User Engagement at NeedyMed, and before we get started, I'm going to offer a few tips so you can make the most out of today's presentation. First of all, if you do have questions, you can go ahead and ask them at any time by typing them into the questions section of your GoToWebinar control panel. Just know we do reserve answering questions until the end. If we don't have the time to answer your question, we'll follow up with you by email. But of course, I will also provide the contact information for NeedyMeds and the PAN Foundation at the end. Also, this webinar is being recorded and will be available on the NeedyMeds YouTube channel. And as you saw on one of the opening slides, you can find some of the materials, including our PowerPoint slide decks and other handouts we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's get started with what is NeedyMeds for those of you not familiar with our organization. We are a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and his friend, Libby Overly, who was a medical social worker. What you're looking at is our mission statement, but simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put up a screenshot of our homepage because our website is really the face of our organization, and it gives me a chance to point out a few resources, such as if you are interested in finding healthcare cost savings options, check out the Healthcare Savings tab. To stay up to date on what's new at NeedyMeds, check out the Education tab. This is where you can sign up to receive webinar announcements, our monthly newsletter, Vitals, order brochures and drug discount cards. So check out that tab. In the beginning, I did mention that this webinar is being recorded and that you can find it on our YouTube channel, and you'll see a link to that on the top right of our homepage with the rest of the social media icons. Now, under that Education tab, you can find other upcoming webinars, but you can also find those on our calendar of events on the bottom right hand of our homepage. So please check that out. And as you saw a couple of slides ago, a big part of our mission is education. And we define that, of course, by educating people about NeedyMeds and the resources we offer, but also by informing our users about other resources that will help them on their health journey, such as the PAN Foundation. So we are so pleased to have our guests, Audrey and Joan, with us today from the PAN Foundation. So first, let me tell you just a little bit about PAN. They help underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. Really important. So now let me tell you a little bit about my friends and our guest, Audrey Cordy and Joan Zhang. Audrey is the Senior Manager of Provider Relations and helps to develop and implement PAN's provider outreach strategy. She has more than 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care programs. She holds a Bachelor of Science degree in Business Marketing from Syracuse University. Joan Zhang, is the Manager of Medical Affairs at PAN and reviews clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. Joan is a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah University, Bernard J. Dunn School of Pharmacy. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic end the screen to Audrey, so bear with me while she grabs that. And as we transition, I want to remind everybody that, again, if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. With that, I'll pass the mic to Audrey. Thanks, everyone, and enjoy the presentation.
Thank you, Carla, for that warm introduction. Hello, everyone. We are so glad that you were able to take time out of your busy schedule to join our webinar this afternoon on connecting underinsured patients with the treatment they need at the Patient Access Network Foundation, also known as PAN Foundation. My name is Audrey Corte. I am the Senior Manager of Provider Relations at PAN, as Carla said, and I'm joined today by my colleague, Dr. Joan Zhang, our Manager of Medical Affairs. Today, we will introduce you to who we are, why we do what we do, and how you can apply and receive assistance with the PAN Foundation, and additional resources to keep you connected. We know that we will share a lot of information and you may not be able to absorb it all, so we encourage you to send us your questions in the chat box during the webinar. And as Carla said, this webinar will be recorded and it will be distributed to attendees and those who registered. Okay, let's go ahead and get started as to why we do what we do. As you may already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which can negatively impact both quality of life and the course of a disease. High cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket by the patient. These out-of-pocket costs come in the form of deductibles, copays, coinsurance, and premiums. Patients who have insurance but cannot afford the out-of-pocket costs associated with their treatments are considered underinsured. A 2018 study by Kaiser Family Foundation found that on average, Medicare beneficiaries spend 41% of their Social Security payments on out-of-pocket costs and will rise to 50% by 2030. Another study by the Commonwealth Fund reported the underinsured population in 2020 as more than 40 million people and is expected to grow, creating an even bigger gap in the underinsured population. For many patients with chronic, rare, or life-threatening diseases, this cost of care can add up very quickly, putting many in the underinsured population. In 2020, Chagall Research conducted a survey to assess patient satisfaction and the perception of services provided by PAN among patients receiving financial assistance. After receiving assistance from PAN, an estimated 94% of patients responded that support from PAN made them more likely to take their medications as prescribed and had a positive impact on their families. Also, 92% reported that support from PAN improved their quality of life and decreased stress for the whole family, showing a genuine need for the safety net that patient assistance foundations provide for the underinsured population. To demonstrate this, here are some of the things that our patients are saying about us. One patient said, "When I was diagnosed with early stage Parkinson's disease, I was started on a drug that caused my hands and neck to tremor. My doctor recommended a new treatment that would stop the tremors, but I couldn't afford it. With the support of PAN, I am given the opportunity to take the new medication and continue enjoying each day with my family." A second patient wrote, "Getting diagnosed with cancer is not easy. I have amazing emotional support. However, being a small business owner with a high insurance monthly premium can be extremely stressful. Your foundation is literally saving lives. I am so touched by the assistance towards my medication costs. Having one less thing to worry about as I focus on my health has been the biggest sigh of relief." At the Patient Access Network Foundation, we believe that out-of-pocket costs should not prevent anyone from obtaining medically necessary treatment. So today, we will tell you how PAN can help remove some of the financial barriers and alleviate high out-of-pocket costs for the underinsured population. However, we wish that there was no need for the safety net that we provide. Now, let me begin by telling you who we are and how you can apply for assistance with PAN. We are a nonprofit organization, and we're dedicated to helping underinsured people with life-threatening, chronic, and rare diseases get the medication and treatment they need by assisting them with their out-of-pocket costs and advocating for improved access and affordability. Since 2004, we have provided over 1 million underinsured patients with $4 billion in financial assistance. We know that more and more people need help accessing their treatment than ever before. So we have three types of assistance programs to help patients with their out-of-pocket cost. The first program is our medication assistance program, which assists patients with deductibles, copays, and coinsurance for their medications. The second program is our premium assistance program, which assists patients in paying monthly primary or secondary health insurance premiums. And the third program is our transportation assistance program. We broadened this program last year to include all disease funds. The program covers travel expenses sustained from the patient's treatment visits. Once approved, the Transportation Assistance Program covers rideshare, car rentals, parking, and airfare. We also cover approved lodging such as hotels, Airbnb, and temporary housing. Also want to note that to qualify for our transportation program, the patient must be enrolled in one of our medication assistance programs. All our programs are allocated in the form of financial grants to help the patients pay for their prescribed medication, transportation, and insurance premium. We provide assistance across 70 disease funds ranging from chronic to rare and oncology diseases. We recently added hemolytic uremic syndrome and neuromyelitis optica spectrum disorder to our list of disease funds and launched the COVID-19 Financial Assistance Program in 2020 to support those affected by these uncertain times. The COVID-19 Disease Fund is unlike any of our other assistance programs in that it covers a range of services, including over-the-counter and prescription medications, medical supplies and equipment, and transportation to medical or pharmacy appointments, as well as groceries and meals. To see a full listing and current statuses of all our programs, please visit our website at panfoundation.org. A common question we receive is what medications we cover. Well, we make sure that every disease fund has its own formulary list of drugs considered for reimbursement. PAN is also diagnosis-based, and so in addition to our formulary, we have a complete list of included diagnosis codes under each disease fund. On each specific formulary, we cover FDA-approved medications or listed in official compendia or evidence-based guidelines indicated for the specific disease fund. These includes all prescription medications in the fund formulary, such as brand and generic medications, bioequivalent or biosimilar medications, specialty drugs, and radiopharmaceuticals. Very few disease funds also cover medical supplies for administering treatments. An example of this is our Parkinson's Disease Fund. Now that you know what PAN covers, let's underline what is not covered, since we receive requests for payments for these products and services. PAN is a payer of last resort, which means we pay the patient responsibility or out-of-pocket cost after the insurance makes a payment. Therefore, we do not reimburse any medication which is covered at 100% by the health insurance or medication the insurance did not make any payments. Also, your medication must be on the specific disease fund formulary to be considered for reimbursement. However, there is an exception to this rule. If a medication is indicated or guideline recommended for a specific disease fund, but it is not listed on our formulary, you may submit a request on our website or by calling us to add the drug to our formulary. We will review your request and provide a determination. Finally, we do not cover services such as doctor's visit, lab work, genetic testing, hospital visits, and diagnostic testing. Our grants provide 100% assistance support for most of our patients. We look at the historical data and industry trends to determine how much a patient is going to need for a specific disease fund and allocate a certain dollar amount to that fund. If the patient needs additional assistance because their out-of-pocket cost is higher than the average, we offer second grants to cover the remainder of the enrollment period. This means that if the disease fund is open at PAN and you run out of funding before the enrollment period ends, you can apply for additional assistance called a second grant to cover the remainder of your eligibility period. In addition, we review all assistance amounts annually to adjust and ensure patients receive adequate financial support throughout the year. There are three types of statuses at PAN. We have open, closed, and open in waitlist status only. When the fund status is open, it means that funding is currently available and the disease fund is open to all to apply for assistance. When the fund status is closed, it means that funding is currently not available in the specific disease fund. If you're interested in applying for assistance when it opens, you can add yourself to the disease fund waitlist. You will receive notification when the fund opens in waitlist status, asking you to apply. Waitlist status only. Our final status, open in waitlist status only, means funding is currently available, but it is only available to those on the waitlist. Therefore, only individuals on the waitlist can apply during this status. It's crucial to understand the different fund statuses at PAN to optimize your search for financial assistance. The next few slides will focus on applying for assistance at PAN. There are 4 easy steps to keep in mind when applying for assistance with us. First, we want you to check to see if the disease fund you're interested in is open. Second, verify if the patient meets the eligibility criteria. Third, gather all the required information. And then fourth, contact us to apply. So let's go ahead and take each step for further review. Step 1, check to see if the disease fund is in open status. There are several ways to do this. You can go on the PAN website at panfoundation.org under Find a Disease Fund or type in the name of the disease fund on the homepage. Another way to verify if the disease fund is open is by visiting our patient, provider, or pharmacy portal to verify the fund status under the Disease Fund and Medications tab. Finally, you can call us to verify the status of all our disease funds. Step 2, verify if you meet the eligibility criteria for the disease fund in which you are applying for assistance. The following are our eligibility guidelines for all our disease funds. 1, you must be getting treatment for the specific disease fund you are applying. This means If you're applying for assistance for asthma, you must be diagnosed with asthma or one of the underlying diagnoses under the Asthma Disease Fund. 2. You must have health insurance that covers your qualifying medication or product. 3. The medication or product must be listed on the specific disease fund formulary. 4. The patient's income must fall 400 or 500% at or below the federal poverty level specified by the assistance program. It's important to note that the insurance and income guidelines vary for each assistance program, so be sure to verify this and all the program guidelines on the specific disease fund page. 5. The patient must live and receive treatment in the United States or U.S. territory, although U.S. citizenship is not a requirement. The following slide is an example of a specific disease fund page on our website. Here, you can verify the assistance amount, eligibility criteria, as well as the medications considered for reimbursement and covered diagnosis codes, as we discussed earlier. This slide is the homepage of our website. On this page, patients, caregivers, healthcare providers, and pharmacies can check eligibility or complete the entire application. Step 3. Gather all required information. If you meet all the criteria listed on the previous slide, you will need to gather the following information before starting the application process. You will need the demographic information, such as the name, address, phone number, and email address. You will also need the diagnosis and medication name, as well as your health insurance information and your income and number of people in your household. Finally, you will need your physician and their facility's contact information. Now you're ready to submit your application to PAN, which is our step 4. There are 3 ways to do this. You can, 1, log on to one of our 3 self-service portals listed here. And as you can see, each portal is designed with the end user group.
Hi there, Joan. So sorry to
Well,
interrupt your presentation, but can you go back just a sentence or two because it looks like your audio popped out momentarily.
sure.
Wonderful.
Once you gather all the information, you are ready to submit your application to PAN. There are 3 main ways to do this. You can, 1, log on to one of our 3 self-service portals listed here. As you can see, each portal is designed with the end user group in mind. So we have the provider portal, which serves our healthcare providers. Then we have the pharmacy portal, which is intended to serve our pharmacy personnel. And then most importantly, our patient portal, which is designed to serve our patients and caregiver population. You can also apply right on our website, as we discussed previously. Finally, you can give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263. On average, it takes less than 10 minutes to complete an application, and our enrollment decision is instant. We'll provide you with the enrollment details and processing information right away, and then follow up with an email or fax to the enrolling physician's office upon request. We will also ensure that the enrollment details and processing information are emailed or mailed to the patient. Once you're enrolled, you can begin submitting your claims to PAN Foundation immediately, and we'll provide reimbursement. I want to say thank you to Carla for this opportunity to tell the audience about our programs. And I hope that you enroll with PAN today to benefit from the many assistance programs that we have. And now I will turn it over to Joan, who will share some important reminders about our grants, reimbursement, and support beyond financial assistance and how to stay connected.
Thank you, Audrey. There are a few things to keep in mind throughout the life of your grant. Each PAN grant eligibility period is for 12 months. However, for first-time enrollees in any disease fund, we provide a 90-day look-back period to allow reimbursement for claims that you may have acquired before you contacted us. In addition, we also have a grant use policy, which requires a claim submission and payment every 120 days to keep the grant active throughout the eligibility period. Finally, don't forget to renew your grant after your 1-year eligibility period ends. You may start renewing it up to 30 days before the current grant ends. We want the reimbursement process to be quick and straightforward, so we provide several ways to submit your claims. 1, if you receive your medication from a pharmacy, the pharmacy can bill PAN on your behalf. The second way is if you receive your medication from the doctor's office. The doctor's office can bill PAN. And third, if you prefer to bill PAN directly, you can submit the prescription label or the explanation of benefits for the services or medication you received at the pharmacy with a complete direct member reimbursement form to PAN. Or you can submit an explanation of benefits for services or medications received at the doctor's office with a complete direct member reimbursement form to PAN. Additional information on filing claims and the direct member reimbursement form can be found on our website at panfoundation.org under Get Help. We'll also make sure to communicate with you every step of the way until you receive your payment. We understand that managing an illness is complex, and our patients who apply for assistance with PAN may need additional support beyond financial aid. They may also have questions about their disease, treatment, side effects, and medication adherence. They may also benefit from connecting with a compassionate community that can help patients deal with the physical and emotional complexities of the disease. That is why we have formed alliances with leading patient advocacy groups such as the American Lung Association and the National Kidney Foundation, to name a few, to provide patients with the holistic support they need. When a patient or caregiver applies at PAN, they are given an option to receive communications from a respective alliance partner. Our alliance partner will reach out directly to those interested in learning more if the patient opts in. We have also joined forces with leading organizations to conduct research and take positions on healthcare policies to help our patient population. We have extensive educational resources to understand your insurance and the healthcare landscape, as well as to ask the right questions during a doctor's visit. What's more is you can advocate for better healthcare policies that affect how much you pay out of pocket for your medications right on our website at our Advocacy Center. All of our resources can be found under the Explore Resources page on the PAN website. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we've made our processes quick and simple for you to stay connected. We provide many resources to help you along the way. One way to stay connected is through our portals. As discussed earlier, we have 3 portals, one for the patient, the provider, and the pharmacy. Each portal is designed with the user group in mind. If you are a patient or a caregiver, you may apply at panapply.org. Healthcare providers and pharmacies may apply at providerportal.panfoundation.org and pharmacyportal.panfoundation.org, respectively. On all three portals, you may utilize the following features. You can manage your accounts, review your eligibility period and grant balance, sign up for a second grant if you're out of funds, renew your grant starting from 1 month before the end of your eligibility period, and review correspondence letters regarding your account. In addition to these features, you may also communicate with our portal support team via secure messaging, view processed claims and run reports, as well as upload and submit claims onto the portals. Finally, announcements and updates are displayed on the pharmacy and provider portal login pages. You can do all of this without having to pick up the phone. Another great way to stay connected with PAN is through our newsletters. We have a general PAN newsletter where we discuss new and upcoming events and our positions on healthcare costs. In addition, we have the provider and pharmacy newsletters, where we provide information on our programs, announce upcoming events, provide tips and guidance on how to use our service, our newly added disease funds, and share stories from our patients and program representatives. PAN has also created a free web-based app called Fund Finder. This first-of-its-kind web app allows allows our audience to track the disease fund statuses across 9 charitable copay assistance foundations. You can simply go to fundfinder.org, or you can find the link on our website. Once you sign up, you may follow any disease fund and receive notification alerts via email or text message when the specific fund opens at any of the foundation. Fund Finder helps you to save time without having to check multiple websites frequently. Our goal is to help you find the support and resources you need so you spend less time on the manual work. To demonstrate how Fund Finder can streamline the search for patient assistance, here is a testimonial. One of our healthcare professionals wrote, "Fund Finder saves me from having to search through each foundation's websites, and it allows me to easily monitor open funds to better assist my patients." At the end of 2018, I began using the Fund Finder tool. I can't thank you guys enough for creating this tool. I can quickly search availability of grants across all of the organizations. Fund Finder enables me to help far more patients than I would have been able to on my own. In addition to Fund Finder, we have resources explaining the Extra Help program benefits, requirements, and application process. The Extra Help program helps limited income patients pay Medicare prescription drug costs. It can dramatically reduce your out-of-pocket cost, especially if you take multiple medications. There are 2 levels of coverage, full and partial. People who are eligible for full Extra Help are automatically enrolled into the program, but those who are eligible for partial Extra Help must apply to receive benefits. To determine if you qualify for partial Extra Help, please visit www.panfoundation.org/extrahelp for more information. With financial help from PAN and other patient assistance foundations, patients are more likely to start and stay on treatment, which leads to improved clinical outcomes, increased quality of life for the patient and their family, less time missed at work, and increased productivity at work. We know that PAN Foundation is one of many resources to help you with out-of-pocket costs, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Now I'll switch it back over to Audrey.
Thank you, Joan, and thank you to all of you for joining us today. To learn more about the Patient Access Network Foundation, or PAN Foundation for short, and our programs, visit our website at panfoundation.org. That is PAN foundation.org, and or you can sign up on one of our portals. Finally, you can call us at 866-316-7263, Monday through Friday from 9 a.m. to 7 p.m. Eastern Time. You may also reach out to us using the email address on this slide. If you have any questions about a particular program, or even if you have any questions about a particular situation that you want us to review with you, and we'll be more than happy to assist. We look forward to working with you soon. And again, thank you so much for your time. I'll go ahead and turn it back over to Carla, who will lead us on the question and answer section.
Audrey and Joan, thank you so much for the thorough and easy to understand presentation. No doubt our audience is seeing why we're so proud of our partnership with the PAN Foundation. Not only the breadth and scope of the financial support you offer to your users, but these ever growing ways to stay connected. And what I find really important is the website and everything you guys have built is so user friendly that makes it super important. So a reminder to everybody that is joining us that if you do have questions, and I see some coming in, you can go ahead and type them in to that questions section of your GoToWebinar control panel, and we'll do our best to get to as many as we can. And before we get to some of those, I want to remind everybody that Needy Meds is also here as a source of support if you are having difficulty affording your medications or other healthcare needs. As I pointed out in the beginning of the presentation, turn to needymeds.org and check out that healthcare savings tab. What you're looking at on the screen are all of the categories that you will find under that healthcare savings tab. So check those out when time allows, and don't hesitate if you do have any questions to reach out to our call center counselors. And I will, of course, have that phone number up on the screen as we get to the questions coming in. Also, very importantly, there's the contact information for the PAN Foundation. I encourage you also to check out their website when time allows, and certainly reach out to their call center as well if you have any questions. So Joan and Audrey, we do have a bunch of questions coming in from our audience and that I'd like to get to. So first of all, I think this is a great question. The first one coming in is, what if I don't know the diagnosis code when I call? That's a really good question.
That is a really great question. As long as you know the name of the disease state or the medication you're taking to treat it, our patient support representatives can search the system to determine if your condition and medication qualifies for any of our disease programs. You can also check if your disease is covered by searching your disease name or the disease subtype on the Find a Disease Fund page on the PAN website. Another criteria you can use is your medication. This will generate all of the programs that cover your medication to determine if it matches your disease. And finally, your healthcare provider can also check your diagnosis codes on the website via the search bar or on the individual assistance pages and then apply on your behalf. If you still aren't sure, we can recommend that you follow up with your healthcare provider to determine the correct disease fund you should enroll at PAN.
So important. Thank you so much. Such a great question. And as evidenced by that very thorough answer, the PAN Foundation really goes above and beyond to make sure that people aren't turned away if they simply are having trouble figuring out what the name of their diagnosis is, what the diagnosis code is. So again, the PAN Foundation has gone above and beyond to make this as easy as possible. Another question coming in, and I bet this one you did address this, but it's a great opportunity to drive this home, and I'm sure a question you both get all the time, which is, I don't have a computer, so how do I get help with my medication?
Yes, I can take that, Carla. That's a good question because we do get that often. due to the majority of our patient population, which is of Medicare age. So we do get that question a lot where they don't have a personal computer and wants to know how else they can get assistance from us. There's two ways to do this. They can either call us, which is the traditional way, and we'll be more than happy to assist Monday through Friday. And we usually open from 9 a.m. to 7 p.m. Eastern Time. And our number is on the screen, which is the 866-316-7263. Or another way to do it, since they don't have a personal computer, but most these people these days do have a phone, you can access our website directly from your phone, and you can apply for assistance right on our website. And just a few easy questions, and in about less than 10 minutes, you're able to complete the full application, and we will provide you with the determination instantly. So that is also another way, because I know a lot more people may not have personal computers, but they may have a phone. So this is another way to be able to sign up with the PAN Foundation.
It is true. Thank you so much for that question and the great answer. And another example of PAN removing barriers to make sure they can help as many people as possible. And I will definitely mirror that sentiment that if you don't regularly have access to a computer, as many people don't, you can reach out certainly to Needy Meds via our 1-800 toll free helpline, and that number is at the bottom of the screen, 1-800-503-6897. Our call center counselors are here to help. They're available weekdays 9 a.m. to 5 p.m. Keep in mind it's East Coast time because we are located in Massachusetts. So another question coming in, although the question is a little specific, I'm going to ask it because I think it's the answer is really going to be applicable to a lot of people listening in today. So the question is, my heart failure medication is really high and sometimes I can't afford to pay it. Are you able to help me with the cost?
Okay, I can take this one as well, Carla. I think the first thing that you can do is to check our website to see the status of that heart failure fund or any of our funds. So if you're interested in just trying to get assistance for it, first thing to do is to see what is the status. So if the status shows open, that means you can apply. So what you can do is that you can either go on our website to apply, as we talked about. You can call us as indicated on the slide, or you can use one of our portals to apply. So if you're a patient, of course, you go into that patient apply at panfoundation.org. So there's a number of different ways for you to be able to apply for assistance. And once you are approved, we pick up 100% of the patient responsibility. So all the out-of-pocket costs, which includes either copay, coinsurance, or deductible, we go ahead and pick up 100% of that, as long as it doesn't exceed the amount of your grant that we were able to provide you. And if the fund is closed, what I recommend is that you add yourself to the disease fund wait list to receive notification when the fund opens. That way that you be sure to be one of the first people to get the opportunity to apply once it opens. So it's very important that you do that. You can also go to Fund Finder, which is fundfinder.org, to look and review and see if there's any other foundations that currently have that program open and is accepting application. Of course, you can go ahead and apply with them, but if you're not able to, if there's no other foundations open, at least you will be on our disease fund wait list. And so when we receive funding for that disease fund, we will alert you and we will give you 48 hours to go ahead and apply, and so we can allocate that money to those people on the wait list first.
That's wonderful. And I'm glad you had an opportunity to drive home Fund Finder. I think that's such a valuable resource and a great way to stay up to date on what disease funds are available. And like, again, to stress to make sure you go ahead and get on those disease fund wait lists so you will be noted as soon as the PAN Foundation can assist you with that financial coverage. We're going to wrap it up, I think, with just the last one more question because we do try and be conscious of our attendees' time. So let's wrap it up with this question, which is, can I apply for a second grant if I know I'll need more money for the rest of the year?
Yes, so it is important to know that you're only eligible to apply for a second grant when your current grant balance is $0. But once your grant reaches $0, you may apply for additional assistance, um, the second grant, at any time during the eligibility period, so long as the disease fund is open.
Great. That makes sense. Very clear and straightforward. And I'm so glad the audience participated because these questions, it really gives our presenters, Audrey and Joan, an opportunity to share some more information or drive home really important points. So, as I said, we do try and keep the question segment relatively brief. So, if you did ask a question that we didn't get the chance to answer, as I said, we will follow up with you by email. But of course, we encourage you to reach out to the PAN Foundation by visiting their website, reaching out to their call center. That number is on the screen at 866 316 7263. Of course, I also encourage you to visit needymeds.org and reach out to our call center counselors as well if you are having difficulty affording medications or other healthcare expenses. With that, a big thank you to my friends and colleagues Joan and Audrey for taking time out of their day to share their expertise with Needy Meds users. And Needy Meds users, thank you so much for joining us. We do hope to see your name pop up in future webinars. Thanks, everyone, and have a wonderful rest of the day. Take care.
Thank you, Carla.
Thank you, everyone.